being able to have the conversation on what is it that we need to do, or for these cycles 7 and 6, based on the new guidelines that we are receiving from the Global Fund. The idea is to understand exactly what are the best practices for the communities and for the civil society. The idea is to be able to listen to those voices who represent us in the board of directors, to hear from their reflections, and also to have a space here to discuss and to speak with them, because we know that this is a period of uncertainty. There's a lot of gaps of information. So what we are looking for is to create these spaces, being able to discuss and to see how can we identify what is it that it has to be clarified. So that's the reason why of this webinar. And here we have the presence of our colleague, Julia Perrone. As you may know her, she is the manager for Latin America and the Caribbean of the Global Fund. So we would like to start with her so we can open this discussion from the Global Fund perspective, because she is involved and she's there in the center. So if she can guide us on where are we at. So welcome, Julia. Thank you so much for your time. So please, the floor is yours. Thank you, Anwar. Welcome, everyone, everybody. We are so grateful for your time to listen up on the updates that we have from the Secretariat of the Global Fund, as well as Anwar just mentioned, to listen to the different perspectives from the Global Fund members of the region or other sectors, but that are also friends to the region. So I've had this discussion already with different environments, and it is not easier anytime. Last week in Geneva, we have the Global Health Assembly, so we met with several ministers, and we have several discussions, similar discussions. So we think that this is the proper time so we can start having this discussion with regional networks. We also have a meeting in that sense, as well as with the civil society in general terms. So in order to give you a general context, from the Global Fund, we can say that we are facing a complex situation. We don't like being there. We are not we are not reacting. We are reacting towards this financial situation that goes beyond our wishes, and that make us make some decisions, unfortunately, for the Global Fund, but that these decisions are needed in order to assure the survival of the organization, and how is it that the Global Fund can support the different countries. So for those of you who do not know how does the Global Fund finances work, we have cycles of 3 years, each one of them. Right now, we're running cycle 6 and cycle 7, depending on each country. On a regular basis, every cycle starts once that we had the 3 years grant proposal. So everyone that helps us makes a promise on the funds for 3 years that later on will be reimbursed in periodical reimburses. So the Global Fund cannot take funds because of its legal status. And as of today, in the story of the Global Fund, donors had always turned into, they had reimbursed whatever they had promised. So by the end of this year, we will be able to collect for the cycle 8, and we knew that it was going to be a complex situation within the current context. Unfortunately, we are looking at this, and we are facing these effects of the political context at an international level. So what's going on is that several donors had not given the total amount of the reimbursements that they said that they were going to give. Obviously, the contribution from the United States government is the most important one because the United States represents a third of our global finances. So we also have some other donors that they haven't been able to reimburse the total amount of what they should have reimbursed. So the situation is as simple as that. Based on this current situation, we won't be able to finance all the things that we said that we were going to do so within the cycle 7. So nothing is, this is not finished, this is not ended, because as you know, the government of the United States, they have the revision of the international organizations, and according to the calendar that they have given, ended last week, and yet we haven't heard anything about them. So hopefully they decide something favorable, and at least they can give some of the money that they owe. And we're still having these discussions with the rest of the other donors. But the financial situation that we are facing right now in the bank is truly critical because, well, unfortunately, we cannot keep on waiting indefinitely that the donors decide what to do. Therefore, we will need to take actions. Can you see my screen? I don't need to remind you that this is an essential topic. This is very important because around the world we have saved 65 million lives. It not only impacts for the Latin American and the Caribbean region, but also it has an impact in all the other regions, mostly in those countries that are dependent to the Global Fund, where we are a biggest contributor to offer treatment, antiretrovirals, and all the items needed for these endemic countries, and it will have an impact in their lives that are saved. So the way that we are covering the situation has several stages. The first stage is the one that is already running in all the countries. All the countries had received some weeks ago, they received a letter asking them to pause their activities that were agreed. So in a sense, this is a situation that I will quote the words from our finance director. There is a problem in the water pipeline, so we need to fix that and we need to close the faucet. So in that sense, that's the position that we are at now. We're just cutting the funds, but we are asking to deaccelerate. So once that we are here, and in the meantime, we're just discussing and we're just waiting from the United States, but we have given a term of half of the June, and then after that, by mid-June, we will need to make some decisions if nothing changes financially speaking. So if this is going to happen, then we will need to move, or we need to go back to the stage on reprioritizing. We need to see how much of that percentage is needed and what is it that we will do. And that will mean that we need to reprioritize all those investments that are running already. So these reprioritizations only are included for the global cycle of 7, not for the 6 that are already finished. So for those, we will just cut those activities, or what should be paused or what should be delayed. And formally, we want to reduce the amount of this grant, and because it's not worthy, because it will be ended. Here is the calendar. You can see it in a way that it is shown on the dates. Letters were received on April the 24th, and now the countries are just discussing, just to formalize which are the activities that will be paused. By mid-June, if nothing changes in this financial panorama, hopefully it changes, but if not, then they will receive the PRs, and the country coordinating mechanisms will receive a letter. We will tell them, no, if we said that the grant will be of 10 million, then it will be reduced. I know that everyone will want to know this X amount of funds, because I'm not going to tell you. If you're expecting to receive that number, I won't tell you because I don't know. Nobody knows. So I've told you that the United States represents 1/3 of the grants, and that will give a magnitude level at an approximate level that you can intuit. But things can change. Some of them, if some of the donors decide to reimburse something or the total amount that they owe, or if everyone decide to give the money, then even though if it's zero, that is to say, even that magically all donors will give us a funds, we will keep on doing this, not not by reducing, but just by prioritizing, because it will be needed in so many countries, just to see and to check what has changed in the context since PEPFAR has stopped some of the activities. Because mainly for Africa, between PEPFAR and PMI, which is the bilateral program from the US for malaria, we will need to reschedule that. So once that they receive the letters, the CCM, they will have 15 days to review and also to give us their approval. The approval is not for them to tell us that they agree on the amount and that they will want more. No, and unfortunately, we cannot give more of what we have, but it could be some cases where they would like to redistribute the funds between the diseases. And from there, we will have 3 months by the end of September to review and to reprioritize the grants and to sign the new grants with a reduced amount. So through all this whole process, what you see here is that we need to include this inclusive participation of all the members of the CCM from all the communities, and we want all the members of the CCM should also inform within their constituencies members so they are aware of all these discussions. In this next slide, you are able to see the activities of the first stage. So this is the stage where we needed to delay some of the investments. I'm not going to read them all of them because I'm sure that you have seen these letters already. These are essential activities that are urgent. So the second prioritization that will come between June and September is different from this pause, and we're not speaking about the same activities in this sense. Obviously, we give the same example, but what is it that it has been paused? This monitoring led by the community, or let's say that an interview, the prevalence interview, has been paused. But these things, the CCM consider they are important to take into consideration. So what it has been paused is those activities that are not so urgent, and this might not be the same as the most important things. So this exercise will give you the time for you within these 3 months to see in a more broader way how this could be more efficient. What are the things or what are the governments that can support with this domestic financing, or how can we change the way on working? And in this case, we can see opportunities within the region if we can if we can be more integrated, or if we can demedicalize some of the services, some of the health services, or if the government can commit with the co-financing commitments, and that will give us the space to keep on financing those things that are important for us as well as for the CCMs. I'm not reading all this whole slide, but just for you to give you an idea, when is it that the letter will be sent? We will also send some prioritization criteria. This will be the starting point based on the national sovereignties and to make the decisions, but also for these priority one to save lives, and then the second one to identify people with HIV, and the last one to guarantee primary prevention. This is just a summary on how can we identify the donors, and that doesn't mean that this will be the priority. We need to analyze what will be sponsored by the governments. So, because in some countries from Latin America, this doesn't work because treatment is already guaranteed by the state. So, this has been designed, thought on the Global Fund, where we represent the 2%. This is the same for TB. Diagnosis and treatment will be priority number 1. The active detection and focus detection on cases, priority 2, and the TB prevention, priority 3. Within all these priorities, as a cross-cutting axis, this is the topic of cross-cutting issue is access. So these topics should be strengthened on an ongoing basis, and this should be part of the response. As for malaria, the first priority will be case management, the second one, disease prevention, and the third one, surveillance. So as I said before, this deliberative integration of the health services and human rights, gender, as well as the community systems is essential. So therefore, the how, in this case, it is important as well as the what. So it is clear for all of us, it is so clear to us that if we continue buying medications, but we don't have access to these medications, then the services will be impacted because either the system fall or because the error went by. At the meeting that we have from the board, I agree that, and maybe Javier and Massimo will share a little bit more about that. It was discussed, the topic on what is it that we mean by vital services, life-saving services. What are those? So in that sense, we have tried to give a definition that this is a broad definition, because what saves lives in the country depends on the context. One essential element, it is clear that we should have access to treatment. So therefore, we need to continue assuring the services for diagnosis as well as treatment for TB and HIV, as well as on the case management for malaria. So all of these with regards on the World Health Organization guidelines. So similarly, it is also important to have access. As I was telling you before, those affected communities and populations, we need to consider these interventions that eliminate those obstacles and give access to the services. Also, the health systems and community services that are essentials, and the service platforms. So here we are highlighting again the reprioritization, and this is an exercise that is done at a national level. We're not telling what to cut from the Global Fund, but that will be a lost opportunity. So we need to see the whole context. We need to see who is financing what, and we need to consider also how is it the national response can be more efficient. We know that in our region, the Global Fund represents the 1%, or in most of the countries, it is the 120 or 30%, but it goes from the 10 to 20% in average. If within the 90% of the financing that it's a domestic budget, if we are able to identify and use this as an opportunity to see exactly what are the services that we can reprioritize, or what are the treatments, or what are the regimes that can be optimized, what are the innovations that we can adopt. So this will allow us to release funds that easily can become the finances of these primary activities that the Global Fund is supporting right now. So clearly, this direct financing to the communities might be one of the last considerations that the governments would like to adopt, with some exceptions, of course. But it is easy for us to keep on supporting the communities if there are more things that are taken into consideration, and if there is a more effective response. So I will stop my presentation here, and I will give you the floor, Anwar, and I will stay at the end of the session for the Q&A. Thank you so much, Julia. let's continue. Let's move on. Let me tell you that we will kindly ask you to write down your questions for Julia, if you can write them in the chat box. And then at the end of the presentation, of the presentations from the different delegations, we will have the Q&A session. We will give to each one of them, to each one of the speakers, if you can write down your question and to whom you are giving that question. And also, I would like to end. I just want to say that this is very difficult. This is very difficult for all of us, for the Secretariat. We're just in a crisis situations from 2 months ago. And right now, we're just entering this restructuration that will be also another situation to include all the team. Because, well, as we don't have funds for you, we don't have also funds for us, and we need to be consistent with that. And I think on how we're going to do this will make a difference in the history. People will remember us, communities and countries of the Global Fund will remember us. Hopefully we don't close this, but hopefully we close because we have eliminated these diseases in a couple of years. But what I hope, what I expect from us and from you is that we can achieve, or we can use this as a priority to work together. We are a partnership. No one is imposing anything. There is a reality that we cannot run away from it. The reality is that we don't have funds to do all the things that we were supposed to do. So this reality is outside, and we haven't decided that. Truly and honestly, I beg you to, when you consider working on the teams, on your country teams, that we are all in the same ship, and we need to find a better solution for all of us. Thank you. Thank you so much, Julia, for for your words. I think that in that sense, we can give the floor to the members of the delegations, and that also gives us the the way to have a more in-depth reflections, because of course that are important, and that gives us the guidance on where are we at the process. But in reality, this represents an opportunity for us to think in the future, besides or beyond this crisis. So I will start now with Javier Urcade. He is representatives of the communities. He is holder of the community's representative at the board. So Javier, you have the floor. Thank you so much, Anwar. And please let me know 1 minute once that I need to finish. Thank you, Julia, for your presentation. I think that this gives a lot of clarity within a process that it is truly complex. And these slides are available for you since last week. We're available in French, Spanish, and in English. We have already shared with you, and that's included in the note that you had received as the CCMs and the MCRs and the recipients. So, but of course, it is clear when someone explains. So for the next 3 weeks, it is a strong work. Yes, we can hear you. So we will have a strong work for the Global Fund to determine the allocation of the budgets that will follow the exercise, the allocation on the rescheduling and reprioritization of the cycle 7 round. First point that I would like to highlight here is that the board, we need to inform the countries and our constituencies, in this case, our communities, that we're in the same ship. I know that you are tired of this type of metaphors, but this is a ship that goes towards a storm. And in this case, the Global Fund Secretariat and the Latin American, the Caribbean program, the responsible, the managers, and everyone will do whatever is best in order to impact the less possible to the grants. I can tell that for those who defend the region on a daily basis within the Global Fund Secretariat is the LAC team. And we cannot say that we are bad and good people. The idea is to reduce the impact on this crisis on Latin America and the Caribbean. So what Julia has shown us was discussed last week, and then the implementation is under the hands of the Secretariat together with the strategic boards. So the key actors, just to mention some, the regional team, the gender and human rights community, the platform led by Anwar, the board, the strategic committees. So those are the mains and the different mechanisms that the Global Fund has in order to work together. Neither the board nor the secretariat team meet in a meeting with the door closed, so on how to harm the Latin American region or other regions with this type of diseases. So they will prioritize Africa. That's nothing new for us, but this goes beyond the Global Fund as the Secretariat to the Global Fund and the committees. So maybe I would just want to reinforce some messages. As Julia said, with regards of that time, we don't have that time and we don't have those months that we had in the previous times to prepare the grants. As we know, in 3 weeks, this crazy situation will start in 2 weeks for the MCP and the RP to discuss exactly where is it that they would like to invest the money. So what will be prioritized? I think that was discussed in the board meeting. It will be prioritized whatever is being done, whatever was signed and approved. The only thing that the difficult task would be to recognize those effectiveness activities and the cost benefits. The idea of saving lives is really very important, and sometimes in the wallet of the Latin America and the Caribbean, for us sometimes it's really difficult to define what is survival or against something that is really. So one of the things that the delegations had said is that yes, the communities, medications, the mosquito nets, and other interventions can dust in a warehouse, because in many countries are the communities who make access and to deliver these to the people in need. So if we don't have this dual self-test on HIV and TB, I don't think if this will be the best time to do so. This is something that has to be clear. And as Julia said, there's no money. The reality is that there is less money. The US and North America has not defined the financing for the Global Fund. And as Julia said, the United States give $1 for every $2 that the other donors give. So here we have two donors that they won't give the honor on their promise. And then in that case, even though it is the best time with their best administrations, they won't be able to give this total amount. Later on, we will also face the 8th grant of the resource mobilization. We know that the Global Fund requested for $18 million. And in this moment where there's not enough resources for cycle 7, then this seems that this is an untruth idea. So it is important for us to understand that the Global Fund is not covering those gaps that were not able to be covered by PEPFAR and other agencies from the government of the United States. On the contrary, we are having several complex situations on financing our own projects. So we're still listening to several metaphors. Some are very ugly metaphors. We haven't mentioned them, but just choose whatever you want. We need to reach the port. We need to keep on reducing the new infections. We need to accompany the people with treatments, not to lose them. We need to keep them in the health systems. But we have less resources. We have a lot of fuel to get there to the port. But as we were saying, also we are facing this big storm. Also, as Julia was mentioning, this is the topic of the nature of the Global Fund. The Global Fund, since 20 years back, has a vertical way on investing, but also there's a commitment from the governments for those who receive the countries, from those countries who receive the funds, that they need to give their part. So this has been an unicorn. There are so many countries that when they write their proposals, they have given many, many big dreams, and they have not invested at a domestic level. So we as a community, as a civil society, we also need to go together with other governments, and we need to tell them, you need to put into practice whatever you said. You need to include those money in those gaps that we will have on this reprioritization exercise, plus whatever was lost from those specific activities from the United States agencies. Could be PEDFAR, because for them, there's no so big impact from South America rather than Central America. The relevance, the importance, we need to discuss and we need to be honest on what are those interventions that are relevant to achieve the goals and the commitments from the grant of each one of the countries in the region. And just to finish, as for the transparency matters, information will flow through the main receptors and the CCMs. There's nothing new in that. You know that with all the problems and crises that we're facing, or at an institutional level, with the RP or with the CCM, always the Global Fund has communicated through these two entities, and it is the main receptor and the CCM that are there collated as heads of the civil society and the key populations on HIV and communities, and they have the representatives and the CCMs and the RPs. So how is it that this dialogue will be there? I won't want to be in the CCM where I can speak with my constituency and the people and the communities or the organizations that I represent. There's nothing new there. So it is important, and we have insisted in different ways, in different manners, and emails and fora. It is important for you to be ready to prepare, because once the race starts, one of the posts of the first post will have 2 weeks, and it is our own responsibility as representatives of the CCMs to do these fast surveys, to make decisions, to make these difficult decisions. For those who are in the Global Fund, Maximo, Yolanda, and myself, we can say, as Julia was saying from the Secretariat, this is not an easy work to do. In the last meeting from the Global Fund was really difficult. You received this letter from the communities in Spanish telling exactly what we saw and what we are proposing as civil society and communities. So I think that Lidice or someone else is also helping us and giving you the links, as well as the presentation given by Julia. And one final element in this complex situation is that we should be able to involve the Pan American Health Organization and UNAIDS, who are included or not, just to give us data. If a decision needs to be taken in the next week or months, you need data. You need to make decisions based on the evidence, so you can say, we need to keep on doing this reference and the retention in patients in these services. Otherwise, they will go out and they will come back with diseases, and most of them will die. So that's another strategy on saving lives. Everything is related on how is it that you are proposing it. I don't think that crises always create opportunities, but I think that altogether we can do and lose whatever is the less, and being able to achieve the mission. In a couple of weeks, we will know exactly the amount of that resources, and we will see what will be the proposal as a whole from the Global Fund. So thank you so much. And I would like to listen to Massimo and Yolanda also to answer your questions. Thank you so much. Thank you, Javier, for your reflections and your guidance. In this line that where Javier just mentioned, I would like to highlight here some of the initiatives that are taken care of in order to understand exactly where we are at. There is a WhatsApp group with members from the communities on the region who is been open. So in the chat box, we invite you, there is an invitation for you to join into this chat box. It is important for us to understand exactly what's going on at the country level. So that group was created in that sense, to receive the guidance, to receive your worries, your concerns, so we can keep on processing that, so we can have an idea and see what's going on. I would also like to mention that within this meeting, we have the presence of our colleague, Anna Sharp, and she's also giving us some tools in the chat box that are being developed. So we get that support within this process. Tomorrow, as the platform, we will release a newsletter for us to show you exactly where are we at with this information that's being released little by little. With that being said, I would like to give the floor to our colleague, Yolanda Paul. She will speak in English, so I will kindly invite you to, for those who are in the channel, in the Spanish channel, go back to the English so they can hear. So Yolanda, she is representative of the delegations of the NGOs from those developing countries. So Yolanda, thank you so much. Thank you so much for being here today with us. Hopefully everyone is in the English channel, Spanish channel. Welcome.
Good afternoon, everyone. My apologies for being late. It's always bad to speak after Javier because, and I love him dearly, and he knows why I tease him because now I don't know what to say. But so let me just quickly introduce myself. I'm Yolanda Paul. Myself, along with Angela, I think Angela is on the call and she's from Ecuador. We're both members of the Developing Country NGO delegation, and Angela, please feel free at one point to tag team anything that I may miss from our delegations. And Javier and Julia covered a lot of good ground and gave a lot of sound direction and advice. There are just two or three things that I quickly would like to highlight. So let me start with Julia. When I joined the call, you were talking about life saving. And in that document that was that um communication that was sent out from Global Fund to all of the country teams, it included a definition on life saving in there. And I wanted to contextualize our conversation at the board around life saving. We developing country NGO, communities, developed country NGO, even Latin America and the Caribbean delegations, we advocated very hard to ensure that life saving is wrapped around the Global Fund's mission and strategy. And that is not just saving lives, but putting communities at the center. Because we heard and we've been recognizing that globally, the communication that has been going on to the ground meant that people were not talking to each other. Governments were making decisions that excluded communities, that did not identify programming within the grants that was saving and molded in reaching our communities and having communities meaningfully involved. So the one thing I want to say to you is when you go back to your CCMs and at the country level and you're talking with all of your stakeholders, it's muy importante that we discuss with everyone, that you choose your life-saving programming and identify your priorities based on not just saving lives, but ensuring that communities are kept at the center of each of the responses. So a lot of our community-based activities like CLM, for example, we can't afford to cut those things. So I'm just giving that. So my first point is on life-saving. My second point is on CCMs. Javier alluded to it, and forgive me, because I'm not as familiar with the CCMs in Latin America, so my apologies, but there's one critical thing I want to say. At the board, we made it very, very clear that as delegations, we're going to be checking in on the ground to see how that engagement at the CCM level is happening. And when we talk about engagement at the CCM level, we're talking about inclusive discussions led by involving CCMs, involving our communities, involving our CSOs, having a fulsome discussion at the national level about where the priority should be. Folks, it is not about a government PR or any PR for that matter, deciding single-handedly what the priority should be in your grants. You have a voice and you have to raise the voice. That leads me into my third point about how us as delegations can support you. If something is happening on the ground and you recognize that CCMs, communities, national stakeholders are not meaningfully engaged in this reprioritization conversation, we would really like for you to flag it with us. You have Javier from communities, you have myself and Angela from developing, and you have Massimo from LAC. It's important for us to be able to lift these things and to be able to say it to the Global Fund Secretary that these things are happening on the ground. The fourth very quick point I want to raise is around, I know that we're anxious because we're currently in GC7 and we're doing this reprioritizing in GC7. And then on the tail end, we're also dealing with the eighth replenishment. I think what we have to put at the core are two things. Whether we like it or not, guys, we're at that state where we have to think about what we do differently and how, and what is the value for money. So even if you're only given $1, how does that $1 stretch and save and maximize? And it is unfortunate that we have to be doing this in a rush. It is unfortunate that we have to be doing this in a way where we have our back against the walls. It's a Caribbean saying, with your back against the wall. But we have to think on our feet now and do things differently. And I'm coming onward. I'm stopping right now. My last point, the use of technical partners. I think, have you touched on that, right? Because you spoke about technical partners with data. I want to add and build on that because we have technical partners on the ground who can be involved in these national conversations. So UNAIDS, and I'm just using the HIV response as an example. UNAIDS is always talking about at the board level how much that they are supporting at country level. Tap into UNAIDS, knock on UNAIDS doors and say, listen, we want your support as a technical partner to be able to ensure that we have an inclusive conversation. Help us bring communities together. Help us dissect this information in layman language so it's not all technical. Like, use our technical partners because they're there for that purpose as well. And now is the time to maximize their value in a very technical conversation that's going to go very, very quickly. And if there, my very last point is if there's any information that is coming out that you recognize at country level is not being understood properly and it's not being implemented well, I think it's very important for us to reach out to Julia, reach out to the delegations, flag these things because we don't want to hear 3 months down the road or when is a deadline halves in June or where we are 3 weeks down the road that countries were not understanding. We need to get that message from the get-go so that we can have meaningful conversations. I'm just going to quickly see if Angie wants to add anything briefly. Angela, I don't know if you're on. Yeah, so Angie, you can take my 2 minutes, my last 2 minutes if you want to add anything. No, Angie? Yes, Angie. Okay.
So sorry that I spoke in English, but I was just following the conversation.
That's okay, Angie. Thank you very much. And I will also put my email address in the chat. So if there's anything that you want to share with our delegation, we're happy to do so. I have to run at the top of the hour, unfortunately. I'm so sorry. I can field as many questions as I can, but hand it over to Angie, Javi, Massimo to just finish a conversation. Thank you, folks.
Thank you so much. And I would also like to recognize this invitation that if you have questions, please include them in the chat box of the Zoom meeting. And then after Massimo's presentation, we will give the space for the Q&A session. So let's continue with the delegation's presentation. This is next presentation will be from Massimo Ghidinelli. He belongs to the Latin American and the Caribbean. He's an alternate director. So do you feel speaking in English or in Spanish as you wish? It could be in Spanish. Thank you. So remain in the channel, in the Spanish channel so we can hear. Thank you so much, Anwar. Thank you so much to my colleagues that have given the voice, Julia, for setting the scene and to share a little bit of the updates and the information to know exactly what's going on with the communications sent. And Javier and Yolanda, it's been more complicated now speaking after these both speakers, but I will try to share with you some of my reflections. Before that, I would like to remind you that it is true, yes, we're facing this situation that it's a lot of uncertainty. So maybe the level of uncertainty will let us know. It is not that we are not surprised, but the intensity and the confusion that has been created in the last months, I think that it's complicating a little bit more this uncertainty framework. It is not easy to listen to Julia that we're just living in this situation within the secretariat. So hopefully with several measures, we can have a total control of the situation. There's no doubt that the secretariat will continue and will keep on doing whatever is needed in order to mitigate this situation. But I do believe that the most propositive way that we can find out is the maturity of the partnership. The Global Fund has an experience of more than 20 years, and it is true that never in its history has had a fundamental crisis as this one. This will be This is the first time that they need to review whatever has been committed and what the countries had already started to implement. But that is a fact. This is something that we should face, and that's part of our reality. I do believe that with this maturity from the Secretariat, as well as with the historical activism that has also been highlighted within the Latin America and the region and the Caribbean region, I do believe that we have the resources to face and to respond towards this crisis that it's been impacted all of us. It is clear that we are just about to start not only a climate change, but also an important change. The response to the three diseases won't be the same in in the days to follow. So where are we going at? We don't know. We don't know. We don't know with the clarity. We keep the commitments that had been defined, even in the development of the last strategy of the Global Fund. The North remains the same to end with the three diseases for 2030. And I do believe that that's the territory where we recognize ourselves and we will move forward on that in that sense. Another reflection that I would like to share with you is that this crisis it's coming from far away, and we were just impressed on the confusion and the level of intensity that it has carried out. But I can assure that more than a year back, and Javier and Yolanda are witness, as well as Julia, of the intensity on the work that the Secretariat and the governance of the Global Fund on how is it that they had given from more than 1 year. So we had, they had created to formulate several policies focus on a preparation, what Peter Sens mentioned, a plan for all the weathers, all weather plan, in order to prepare in an efficient way the global fund towards a geopolitical, financial, or climate change, including all the factors that are marking this crisis that we are facing. So through several stages, through several meetings from the board of directors, as well as from the committees, and also through the redistribution of different content with the webinars and with meetings, as well as with several joint sessions. And just in brackets, in our region, we have the luxury on having this dialogue that includes members from other constituencies. So this is not a reflection merely in the endogenous, but this is a reflection that invites to have the perspective of the communities as well as civil society. And many among you might remember some other webinars where we have shared this same position. The idea is to share perspectives so we can understand better what are the changes, so we can start on them and we can interpret also the opportunities that are given also when we face this crisis situation as this one. So therefore, in all this work, in all this reflection and in all these changes on policies, the North and the main axis has been the issue of sustainability. How can we guarantee sustainability to the response to the three diseases by navigating in these waters that are truly extreme and with a lot of uncertainties? So, two main principles fed this reflection. First, we need to assure, and this is a topic of equity, we need to assure most of the resources to those environments of low income and with a high level of the disease. And the second principle that goes directly to us is to protect or to keep on prioritizing the protection of the most vulnerable communities and to the most exposed to the three diseases. So therefore, we had worked a lot in order to articulate those priorities within this context. I remember that Latin America and the Caribbean do not represent a bigger representation, and which is really marginal in the total investment of the Global Fund. We're speaking about nearly a 3.5% of the total portfolio. So that's what has been given to the region as of now. But we also recognize the value highly strategically of this investment that will allow us to have these dialogue and cooperation mechanisms as well as the inclusion mechanisms that but that probably will be more complicated without having the availability of the global fund resources. So I do believe that we need to keep this front. It has to be compact to face this serious situation that we are facing. We have also had a lot of tension on the need on giving the definitions. Yolanda gave it so clear. What is the service? What is the definition of vital services? How can we prioritize in this big menu where all the interventions are really integrated and hyper-connected? It's been more than 20 years that we've been working HIV, TB, and malaria with this posture. So it is a very complicated environment, and without a doubt, the need to cut those budgets, we will learn. We will learn in a few days or a couple of weeks. We will identify we will know the cuts. Some of it has been announced with what's going on within PEDFAR and the bilateral donors, but in a few weeks we will have more clarity with regards on the financial availability, so we can continue with the movement of this cycle 7. We haven't considered on those investments where we had to work in order to give the proposals, to review them, and to move on all these approval mechanisms, and then finally start an implementation that right now it's under this uncertainty. So, but I think that the message is clear through this dialogue, a very inclusive posture. I do believe that all the voices will have this value. I I'm glad to see that there are 112 participants in this webinar. This is good. This is an emergency situation. We are facing a crisis, and we all need to have a very active participation. We also need to share these perspectives and also to keep a very firm dialogue. Fortunately, the Global Fund maintains and has maintained all those mechanisms that allow us to have this dialogue and to have this inclusivity. So count on us for any other activity. I think that we have a second webinar this week with the GCTH, another important mechanism within the region that can put together several actors as well as several partners that are on this HIV response. Unfortunately, they didn't include the other two diseases. So, but they are still an important bridge between the institutional civil society, the communities, the academy, and all the partners that participate on the response to the HIV, and in a broader perspective to the three diseases. So with this, I finish, Anwar, and kindly I will answer any question or any clarification. So thank you so much. Thank you, Massimo, for your words. Thank you, Yolanda and Javier, for this session. So now let's move on. Let's continue and let's go to the discussion. There are some questions that were set in the chat box. The next session, then, so I will ask my colleague Lidice Lopez to guide the Q&A session. And before giving the word to Lidice, she's familiar also to the region of key correspondence. She was working for the America Latina and the Caribbean. So I just want to say that we will be observing what type of information is being released in the next weeks, and if it's needed to organize another webinar that it is related more with more programmatic aspects, for example, once that we have more clarity on the mechanisms or on the funds or on the information that's being released from the Global Fund, we will open the spaces that are necessary so we can discuss about them and we can show our concerns and questions. So we will continue working on the communication groups, and we will be releasing all the information that comes into our hands. These presentations will also be available for you. And tomorrow we will release a newsletter. There are also the tools that Alana had given us in the chat box. So we're trying to give all this package of information and with all the resources that are available. So Lidice, the floor is yours. Thank you so much. Thank you. There had been some comments in the chat box that I will turn into questions. So mainly for Julia, there are some questions on different processes and how this process will be guaranteed. So one of the questions that we have here on the comments is regarding the participation of the communities in these dialogue sessions in the CCMs. Most of them mentioned the need and the importance. Yolanda spoke about it, as well as Javier and Massimo, on the importance of the participation of the civil society organizations within this reprioritization process. So turning this statement into a question, how from the Global Fund is that they will protect this participation in the countries, and if if this prioritization process will be accompanied on guiding the sessions or being present there. So that will be one first question. Another question that has been shared in the comments and that we have heard about it is also related with the monitoring led by the communities, by the CLM, to promote and to manage this CLM. The question is, how much can be prioritized within this process, and also to keep the CLM, to keep them within these processes, within these reduced processes. There is another question that shows an optimistic scenario. So what happens if the situation improves? Of or if these are of the or if the funds from the countries are being shared? This is something of what Javier mentions as something from the future. Is there any plan B or C for that scenario? And then another question that goes more towards the members of the board, Massimo, Javier, and Yolanda. What can be expected from the civil society organizations as well as from the activists on this uh, advocacy? Because we have known from those countries of mid-income that had transition in those actions on the HIV, TB, and malaria responses, they assume most of the budget and most of the response. But what about these advocacy activities? They are always covered by the corporations, and they are needed for the states to move on. So where are those activities included within this reprioritization process? I think that with these 3 or 4 questions is enough to start answering, and then we will go back to continue with 3 more. So yes, Julia, the floor is yours. So these are really good questions. How we're going to guarantee the participation? So in that sense, I think that to guarantee the participation of the communities, it's a joint activity. I think that this is a joint activity. Within all this is not something that a global fund is going to do if we don't receive your help, if we don't receive the help from the states, the communities. Being said that, this letter will be given to the MCP, to the CCMs, and the first letter was sent to the presidency and vice presidency. So today we will send to all the members. Obviously, the country teams will organize meetings with the CCMs and they will discuss whenever is possible. And among the different things that we are reviewing, not in a positive way, of course, is travel. So I think that it will be really useful if we can go to the countries to be included in those conversations in person. But I cannot guarantee because if we are not funds, it will be complicated. But within the fund that we have, we will give a priority. It won't be possible for us to follow up each country of each meeting of each country because it, it's not there's not enough resources in the secretariat. We're just 10 managers for the portfolio, so we cannot follow the whole region and to assure the direct participation. We will do our best, and that's why it is important that we have these instruments such as the note on the performance of every CCM that can give us on the indicator that where can we get closer to the index or to the note that we give them in their participation where we can see that it's low. So in that sense, we can spend more time as well as if the CCM will have some technical assistance budget as well as the LAC platform, but there will be just a few and we will be able to support the whole region. And yes, the most efficient way is to see if within the country, so we can have a reaction. As for this monitoring led by the community, what will be, how will it be done? We cannot do it alone. Uh, we need you. And something that, how is it that CLM it's truly loved by the communities for good reasons? I don't want to give you the impression that it's untouchable. No, nothing is untouchable in this crisis, with the exception maybe of the antiretrovirals, but nothing is untouchable. So the idea is to have these proactive discussions. I assign a specific person from my team to review that this is done. But if there's another one, the idea is to document this and it's done in a professional way. If this situation improves, then we will have a virtual meeting to celebrate, followed by a big party. But in most countries, even even though we receive, and I will invite you to the data hub. I was looking at them because it's really well done, and you can see the numbers on how much is needed, and then you will see there if we will reach those figures. But even though if we reach that, many countries have biggest gaps than when we signed because PETFAR also left. And also the CLM, we know that Perfect was financing more of that and they left. So I think that most of the countries, we need to reprioritize just to see if there are some urgent things that Perfect was not financing. If we can consider those, that's the opportunity, even though there are no these cuts. So now I give the floor to my colleagues. So thank you so much, Julia, for your clarity and this additional information. There are some other pending questions there, Javier. Yes, I can answer them. I agree with Julia. And another important message that is important for all of us who are here in this meeting is that there are cuts everywhere. There will be cuts everywhere in the catalytic investment. within the strategic investment and within the secretariat. When we're speaking about the capacity on following up the process, you need to understand that people will be out of their job. And there's a whole process that has started already. There are some cuts and they are just saving money everywhere. So we need to be aware of that. Also, all the actors within this call and for those who are not here will do their best efforts to accompany this process. The better prepared, it will be best. So there was this question about the communities. Sometimes it is difficult for us to link whatever is a community activity with an intervention or with a vital investment that saves lives. But that's our talent. I think that this CLM and those activities, those reference activities and the peers, companionship and all the health services and the liaison in order not to lose them, that's survival, that's vital. And I tell you, if a person leaves the health system, and we have seen that in some countries in Africa, where this order on closing the systems, those people will go back to the health centers with an advanced disease or what we know as AIDS. So that's vital. We don't discuss on that if it's survival or saving lives or not. And then there's some other programs. They might not go out from the third level of the health system or that the RP is working on that, but it goes together with you. So the key word for here is access. For me, the community, civil society, and NGOs, of course, they have a good argument to discuss, and that is access to anything that has been agreed. I do believe, and these are just speculations, we will have these meetings and information. It will be difficult for us to defend an activity that has not been planned. If the activity was not included or not, whatever was not included, I see that it might be difficult unless it has the same result or is more efficient. And I'm saying that with this frustration because they hadn't included these activities. So, or they are a little bit shy. I don't know if this will be the time to increase. And sorry for this image that I'm giving you, but in order to dress a saint, we need to undress another one. So what Richard was asking, the Global Fund was discussed in the last meeting. They see a great opportunity in Capavir. And in fact, there was an agreement, and Maximo won't let me lie, there was an advance agreement with PETFAR to negotiate with the pharmaceutic that introduced the lenacapavir. But for now, the executive director, these technical partners from the World Health Organization and UNAIDS, and we as communities had highlighted that even though we don't have money, we should have this discussion in a very strategic and mature way with the pharmaceutic case houses and for those who will create the generics, because this will be an inflection point that will change our reality. We cannot abandon innovation because we don't have resources. And that would be, thank you. Yolanda, the floor is yours. It seems that she left. Okay, then so now we give the floor to Massimo. Thank you so much, Lidice. 4 questions. I think that Javier and Julia had already answered within several perspectives. So I do believe that on the community participation and the topic of the community monitoring, I think that those are achievements that had defined the quality and the results of the response to HIV and in a certain way for TB also, and within the epidemiological context of malaria also. So it is not only the access, but also I will say that the context has to be included within this analysis. This is an opportunity to consider again the whole package of the response, to unpack all those elements and trying to identify what are those core elements of those responses that are already integrated. It will be very difficult to separate these separate bodies because they are not. All of them contribute in a certain way in as a whole, and some other activities could be defined or could be included or could be set in standby. But if it's not today, it will be tomorrow. So the question, the very complicated question is, how can we do all these unpacked of activities that are already integrated with less resources? How can we do them? That's the question. But let's not forget that most of the funds that are running on the response to the three diseases are domestic funds. Therefore, there will be a reduction, yes, without a doubt. But then the question that comes is with these political incidents and activism and advocacy in general has to include the institutional. They need to have some responsibility within the institutions because some commitments had been assumed as for the co-financing. There are some dialogues that are under these transition processes within the countries. So that means that what historically had been supported by external resources, the Global Fund, or mainly the Global Fund, to a specific moment, now has to be repositioned with the domestic funds. So that's why it is important to have this dialogue within this crisis. And it's important to make this dialogue to turn it into an analysis. The only unfortunate things that we have is time because there's not enough time to do this process. So what we need to do is to go in depth on the revision on the experience of the responses so we can identify those savings area, if we can say that, without losing the objective. Those responses should continue, and we need a constructive participation. Someone or everyone need to quit to something because it won't be the same. It is absolutely impossible. Javier mentioned that it is not only the global fund. The global fund maybe is the institution that is reacting in a more proactive and more structural way to a global crisis. And it's not only the crisis of the HIV, TB, or malaria responses. No, it is a crisis towards the global health in general. It is a crisis on the mother-child transmission. It is a crisis on the immunization. So we are in the same path, yes. Unfortunately, we all are. But I think, as Javier mentioned, there's also opportunities. Now we have new tools. We have this opportunity. So maybe we can continue. So we can continue on this ambition on ending the diseases. And in that sense, we need to reformulate. And in that sense, I see the opportunity. There is this season that needs to be reformulated in depth, but looking forward. Now we're facing this crisis with the Cycle 7 funding process that it's unexpected. So we need to review. We need to review something that has been already signed and has been committed, but there are no enough resources to comply with all those commitments signed. And that's the first step. But then the direction that we'll be assuming in within this dialogue, as well as on these strategic decisions that are taken, should be in order to answer or to give an answer to this crisis and to move forward. That could also set the steps for the next fund. I'm convinced that the global fund will not end, but they need to reformulate their position as well as their portfolio. But they will keep on the same principles and the same logical as well as on the same mechanisms. So therefore, the strategy that currently we are implementing is valid, and I do believe that will be enriched with new opportunities. So please, let's not lose this global perspective. Let's respond to this crisis on the cycle 7, and let's think on the future. How can we guide or how can we reorientate in a more ambitious way the next cycle that belongs to a temporary space for 2030? So I do believe that that's important to consider. We need to keep this ambitious myriad and an ongoing perspective. An emergency situation, in-depth crisis, but mature response. Thank you. Thank you so much, Massimo. With this, with your words, you give us the hope. You give us this hope, saying that this doesn't end here. We're just working within this crisis situation just to be ready to have a mid and long term response, so we can move on the TB, HIV, and malaria. And in that sense, now that I have the floor, I will use my privilege of moderating just to give back to the civil society organizations as well as on to the communities, to give back this role on the advocacy role that has been there always within the civil society and the NGOs in order to obtain or to achieve that response from the states. The states are the one who need to give and to finance, who need to finance the responses in the countries. So that's what we have been doing through all these years, and that they had turned these wheels in the States. There are a couple of additional questions that I would like to set aside. On one hand, these questions are related with with those changes that will appear at an administrative level. The exact question is related with the PRs, and if there will be reductions with regards on the percentages of the overhead or the management expenses that are invested in the managing of the resources. Is there any guidelines in that regard, or is this something that has to be discussed? I think that was the question. There are some other questions with regards of the administrative expenses, also with regards on the participation of the community. So we can have more webinars on that topics. So I think that this question goes directly to Julia. How is it that management issues or expenses will be, how will they be considered within this reprioritization process? Thank you, Lidice. Of course, these management expenses are not exempted on having a situation. I might say that these are one of the first things that we consider, but it will depend on the context. In some cases, we know that we have corporate agreements with with big organizations that legally would recognize the right to charge a percentage. And in those cases, it would be difficult that voluntarily these organizations reduce that percentage because that creates a precedent for other countries. But we are discussing that with them just to see if we can obtain an agreement that applies to different countries. And then later we will do it together. And I'm saying this, truly saying this, because we have examples of different countries where there is a new PR and then the CCM says, we would like this, we would have this, but these management expenses are really high and those had to be reduced. And sometimes it comes from when it comes from the CCM, that helps us a lot from the negotiation or from the health minister, depending on who is the PR. So I think that we need to consider that. We need to look at that together. There will be also several levels of facilities and timings also, depending on the legal framework and the management framework. No, to fire things is complicated in some countries where you are. But yet there is no an imposed solution, or there are not specific guidelines yet, but we need to consider that. We need to pay attention to that. And this is an area that, unfortunately, in Latin America, the amount of the expenses it's among the other countries in a high position. So sometimes it's related with the fact that the grants are small and the management amount is difficult to reduce it. From our side, also what we are doing is that we are reducing the requirements to facilitate that discussion and also to reduce those administrative expenses. And for those countries who are now negotiating these grants for cycle 7, we have introduced a number of different measures to reduce drastically the frequency where they need to report to us, that will allow us then to have another type of discussion. Thank you so much, Julia. So before closing, Javier Massimo, any final comment? So yes, we need to insist that these codes are cross-cutting. And I think that the challenge for us as the communities and civil society, when these grants are being implemented, how can we have this strategic perspective that in a certain way we need to see, we need to say this has to be reduced. But there were also these comments in the chat box. We cannot lose what we have already achieved and gained. Evidently, not the resources not only for those who manage, but also for the societies and communities will be impacted on these cuttings. And that's also terrible because sometimes they are cut in the finest ways. So, but as Massimo was saying, there is a strategy here that we need to contribute for the 2030 to end the diseases as a risk of health, public health. Right now, we're not speaking about these funds from the Global Fund. Some other organizations had disappeared. Donors who were important are just getting out. And sometimes they thought we didn't think that this was going to long so much. And we need to remind that even though we have these 22 years, those cannot be cut. Not saying that climate change is not important, but I insist here that we need to see that we need to stop killing among ourselves, and we need to articulate these discussion sessions and to keep on the strategy, but we need to see also this Excel file. Thank you. Thank you, Anwar. So thank you, Lidice. In the same way as Javier, I think that discussions had been difficult in this past year within the context of the board. We have always tried to balance whatever is the protection on the specific interest for the region, as well as the common interest from the global fund. That still, this is a public good perspective. As for the HIV, TB, and malaria response, it won't be the same without the global fund. And that's clear with all of the dilemma here. And the complex question is how can we move on, keeping on this coherence and also keeping this north that we have already discussed. There's not so good news. There's no many good news here, but there are some positive signals that had been considered. Some new donors, a policy and a strategic practice and an aggressive practice with regards on the resource mobilization. We have heard in the press release from some new funds that started on investing, which is not comparable with the amount of the funds that were given before. It might be reduced or it might disappear. And speaking from the United States, as well as from other big donors that are reviewing to reduce their participation within the Global Fund due to a crisis, due to this geopolitical and financial, military, and climate change crisis. And we can add any other negative element that contributes to this complex situation. But new donors are emerging, and it will be difficult to consider the level of financing for the next cycle 8. But there are some signals that this maturity as well as the efficiency of the mechanism of the Global Fund is still attractive to many donors, because as for the moment, there's no any other mechanisms in the public health at a global level that can guarantee return per every dollar invested. And this is documented. These are not only words on this abstract advocacy. No, this is something that has been documented, and there are plenty of investigations and documents. And we highlighted that the last publication from the Global Fund that is available in several languages, including Spanish. So we do have this capacity. So we try to balance these negative goals, but also with this opportunity sense. Elena Capapir will be a change maker. This will be an element that it is well known in the region, where several stages of the response, mainly for HIV, some other changes had marked the response to this epidemic, and Elena Capapir will be one of these stages, fundamental. We need to keep on working. We need to keep on doing this political incidency, and we all have the maturity and also the capacity from those different actors. And at this moment, I think that it's critical and important to be the voice of those communities and the civil society. We do have this maturity, and we also do have this strong core that can keep on pushing the response and move it forward. Thank you so much, Anwar. Thank you, everyone. So nice, and so glad that after an hour and a half ago, we're still with this number of assistants, more more than 100 participants. Thank you so much. Thank you, Massimo. Anwar, we will give you the floor. Thank you so much, Lidice, for facilitating the Q&A. Thank you, Julia, for your words, your guidance. Thank you, Javier. Thank you, Massimo, for your reflections and for helping us on understanding where we are and how can we move forward. On our behalf, I just want to thank you and also remind you, as we have already mentioned, all the partners from the Global Fund that we are working in a way or the other from these catalytic initiatives will be informing you, and we will be also contacting you on the possible technical assistance support on those countries where we will be able to identify where is this priority to give it. So let's keep in contact. Let's keep the groups alive. Let's keep this feedback also from what's going on within the chat box. It is amazing, all the concerns and all the questions that needed to be mentioned. So these communication spaces will allow us to communicate and to inform where are the bottlenecks, and where are these situations emerging that might stop or that might minimize this participation. So not only with the connection with the portfolios, with the country teams, with the board of the CRG, or with the delegates, all those channels are open. So for any situation, please let us know, and that will help us on trying to understand where we will go forward. So hopefully we'll see in the next webinar. So thank you, everyone. Thank you for your enthusiasm. Thank you for your participation, and we'll see you in the next one. Thank you so much.